Hey everybody, welcome back to my channel, Tribe Nursing here. Thank you for clicking on this video and welcome to the best community on YouTube. Hopefully you all are having a wonderful day. If you are new to my channel, welcome. I make all types of nursing content. I do nursing lectures related to patho, med-surg, and pharm. I also do study tip videos as well as vlogs. Feel free to give this video a like and subscribe. Also, never miss another one of my videos again. All you have to do is hit the bell down below. Today's video is going to be about how CNAs can be organized throughout their shifts. If you are a nursing student and a CNA at the same time, this video will definitely help you out too, because we already know that how taxing and how exhausting CNA shifts are at the hospital or at the retirement home. I made something that will help all CNAs out so much. This video is pretty much for the CNAs, and I really want to help you out because I'm a fellow CNA and I understand what it's like working those 12-hour shifts. So what I did, I made a CNA brain sheet. Let me tell you, being organized is the #1 factor while working as a CNA at a hospital or a retirement home. The reason why I say this is because there are so many things going on. You have to do AccuChecks, you have to get your vital signs done, you have to turn patients, you have to clean up patients, you have to ambulate patients. The nurse is asking for stuff, other healthcare providers are asking for stuff, so there's so much going on. So the question is, how do you remain organized throughout your shifts while working? Well, lucky for you, I made a CNA brain sheet. This thing honestly saves my life. We all know that nurses have their own brain sheets. So what is a brain sheet, you ask? A brain sheet it's a simple reference that you can use to help keep track and be organized of your patients. So let me go over what this brain sheet has for you guys so you can stay organized throughout your shifts. So first off, let me just give you guys a quick preview of what my CNA brain sheet is about. I did add sections for vital signs. I also added a section for blood glucose. I added a section for input and output while measuring those, like urine output. I added a bracket for diet and activity, the patient's room, the nurse's phone number. I added a section if they're isolation or not, and what their code status is. Are they full code or the DNR? So also, I even added a little section for like the ICU, or if you have a patient who has a central line in that requires a CHG bath, I even added a section for that, as well as if they have a Foley catheter in place. I even added a section in that to keep track of whether or not they got their Foley care done. I've worked as a CNA for 2 years at a hospital, and this sheet specifically honestly keeps me in line while working my 12-hour shift. I know exactly what's going on. I know what exactly my patients need and what needs to be done for the rest of that shift. So this is the reason why I created this sheet, so I can pretty much help myself. And then I thought to myself, well, let me help others too. So pretty much this CNA sheet, guys, it really does keep you extremely organized, and it makes your shift that much easier. We already know, working as a CNA, it's a difficult job, and I really do feel for you all because I am a CNA myself. I have 4 months left of being a CNA. What's awesome about this brain sheet, guys, is that it gives you times. So for example, when you start your shift at 7 a.m., I left a little area in my CNA brain sheet where it says at 8 a.m. you got to take temperature, you have to take all vital signs. You have to take the vital signs again at 12 and then again at 4. So that's pretty much how it goes. And then also I did the same thing for the blood glucose, 8, 12, 4, depending if they're Q6 or QID blood sugars. It is multiple sheets, let me tell you that. So when you print it out, you have 1, 2, 3, like 4 sheets you had to print out. Those 4 sheets for the rest of your shift, because each patient has their own bracket. So I'm telling you, it really does keep you organized throughout your shift, because I use this all the time when I'm at work. I do feel like that a lot of CNAs do need an advocate as much as possible. I do know that CNAs require as much help as possible too, because sometimes a CNA have 6 to 13 patients. I think there was a time where I had like 14, 15 patients at one time. But so in conclusion, this CNA brain sheet does keep you organized throughout your CNA shifts. And the reason why I created it is because I struggled as a CNA staying organized. So I had to figure out a way for me to be organized throughout my shifts, so I don't have to be so stressed out. So this is what helped me so much. And now when I go to work, I feel more calm because I know my day is going to be more organized. Also, something that's important to mention is that when I give report, it is so much easier because all I'm doing is highlighting the most important part of each patient, and that's what I'm explaining to the for the next shift CNA. And so that's pretty much the end of the video. I'll also leave the URL right here. Hopefully you enjoyed it. If you did, make sure to like and subscribe. Also, send this video to a fellow CNA if you think this could be very beneficial for them. And with all that being said, thank you so much for watching and have a wonderful day. Tribe Nursing signing out.